I'm Nikki. I'll be taking care of you today. I'm just going to do a quick assessment of your head, eyes, nose, and throat, your heart, and your lungs, okay?
Okay.
First, you look very well appearing, calm, cooperative, well kept. I'm just going to palpate your scalp. Not feeling any lumps or abnormalities, no rashes. Okay, good. Look up at me. I want you to raise your eyebrows up nice and wide. Close your eyes really tight. Open your mouth. Stick out your tongue. Raise your tongue up. Good job. So cranial nerves 5 and 7 are intact. Can you feel me touching your face here?
Yes.
Good. Cranial nerve 7 intact. Open your mouth up wide and close it. Good. That's normal. I'm going to start feeling for your lymph nodes. So back here we have the postauricular, the preauricular, submandibular, good, cervical, and clavicular. All intact, no movement. Is it hurt when I touch?
No.
Okay, good. I'm just going to grab a pen light and I'm going to check the muscle movements in your eyes, okay? So first what I'm going to have you do is I'm going to check the 6 fields of vision. So just follow my pen, okay? Don't move your head, just your eyes. Good, excellent. Now look straight ahead at me and I'm going to move the pen inward. Don't follow the pen, just look at me. Good, normal eye movement. Excellent. I'm going to shine a light in your eyes and check your corneal reflex. Good. Good. It's 3 and brisk. Okay, I'm going to take my ophthalmoscope and I'm going to take a look at all your different inside your eyes. Retina is intact. I can see the optical disc. Excellent. Your conjunctiva is pink and your sclera is white. Membranes are moist. Okay. Your eyes and your eyelashes are all intact. Good fullness. No alopecia. Okay. Next, we're gonna check your ears, okay? So we're gonna do a quick hearing test on you. I'm gonna cover this ear and I'm gonna whisper a word over here. Tell me what you hear.
Apple.
Good. And I'm gonna cover this side.
Banana.
Excellent. I'm gonna take a look in your ear now. Looking inside the ear. Good. Your eardrum is gray and pearly. Ears are symmetric. Is there any pain?
No.
Good. Gray and pearly. No redness. Does it hurt when I touch?
No.
How about the other side? Let's see.
No.
Okay. I'm going to perform a hearing test on you. This is called a Weber's test. I'm going to hold this above your head and I want you to tell me if you hear it evenly on each side or if one side is louder than the other.
It's even.
Okay, good. Now I'm going to perform what's called a Rhine test. I'm going to hold it behind on your mastoid bone. I'm going to hold it there. When you stop hearing it, let me know, and then I'm going to move it. We're testing bone versus air conduction.
Okay. Okay. Okay.
Good. Hearing is intact. Other side.
Mm-hmm.
Okay. Good. Hearing is intact. Okay, so now we're going to check your nose. So I'm going to take a look. First, I want you to occlude one side of your nose and blow. Okay, that side is patent. And the other side? Good. I'm going to look up your nose. Okay, everything is symmetric. No signs of obstruction. Membrane's moist. Good. Okay. I did forget one part of your eye exam, so I want to circle back to that. I'm just going to have you cover one eye and then follow this for me. Now your other eye. Good. That's the cover and uncover test. Okay. So your septum looks good. No obstructions. Everything is moist on the inside. Okay. So now we're going to, I'm going to have you close your eyes. And I'm going to have you smell something for me. Okay. And just tell me what you smell.
Pepper.
Excellent. Good job. Now I'm going to move on to your mouth. So your mouth, let me see you smile. Very symmetric. And now I'm going to have you open your mouth and I'll look inside. Open. Say ah. Okay, membrane's moist. Buccal mucosa moist. Everything's symmetric. Good. No odor. Okay, I'm going to have you stick out your tongue. Use this. I'm going to check your gag. Gag intact. Okay. And then I had you move your tongue earlier, but I'll have you do it again. So stick your tongue out. Lift it up and down. Great. Cranial nerve 12 is intact. Now I'm going to check your taste.
Okay.
So I'm going to have you close your eyes. Open your mouth. What is this?
Applesauce.
Excellent. I also inspected your tonsils when I was in there, and they look good and symmetric. There's no redness, no white pustules or anything on them, so they look nice and healthy. Okay, so now we're going to move on to your neck. So I already checked your lymph nodes. Everything's symmetric. I'm going to check your trachea. No tracheal deviation. I'm going to go behind you and check your thyroid. Can you swallow for me, please? Excellent. Good job. Okay, your thyroid's good. Make sure I covered everything. And now I'm going to listen to your thyroid and your carotid arteries, okay?
Okay.
Good. No bruits. Excellent. Good. And while I have my stethoscope up, I'm going to move down and I'm going to start doing your chest, okay? So we're going to start with your heart. I'm going to listen to the different valves. Okay, so second intercostal space on the right-hand side. This is your aortic valve. Good. Second intercostal space on the left-hand side. This is your pulmonic. Now we're going down to the fourth. This is your tricuspid. And now the fifth of the midclavicular line. This is your mitral valve. Good. Everything sounds good. There's no gallops or rubs or anything like that, so it sounds healthy. Okay. So, I'm just going to take a look at your chest. Everything is very symmetric. Your heart sounds are good. Let me feel your pulses. Good. You have 2 plus radial pulses, which is normal. Okay. And now I'm going to check your lung fields, okay? So I want you to take a deep breath. Okay, good. Your chest rise is symmetric. I'm going to check for tactile fremitus. So what I'm going to do is I'm going to put the sides of my hands on your chest, and then I want you to repeat the word 99 every time I move it, okay?
Okay.
Please go.
99, 99, 99, 99, 99.
Excellent. And now I'm going to listen to your lung fields. Right upper. Take a deep breath for me. Left upper. Left middle. Left lower. Right lower. Good. All lung sounds clear. No crackles. No adventitious breath sounds. Okay. I'm going to percuss your chest. I'm going to listen for any dullness.
Okay.
Good. No dullness, no hyperresonance, so everything sounds good.
Okay.
I'm just going to have you turn around so I can listen to the back of your chest, okay? All right. First, I'm going to have you take a nice big deep breath for me. Good. And I'm going to percuss as I take a deep breath. I'm going to be checking also for the diaphragmatic excursion, okay? So
Okay.
as you take a deep breath, I'm going to percuss between your ribs, okay? Deep breath. Good. Good. And again. Good. Good diaphragmatic excursion. Now I'm going to check, I'm going to do your tactile firmness again on the back. So 99 again, please. Go ahead.
99, 99, 99, 99, 99.
Good. No tactile firmness and good diaphragmatic excursion. Okay, so I'm going to listen to your lung sounds on the back now. I'm going to start with the right upper lung. Deep breath. Left upper lung. Good. Left lower lung. Good. Nice big clear lung sound. Good expansion. Is there any pain or anything like that?
No.
Okay. So I listened to your heart sound, so now I'm just going to assess your neck for JVD. So turn this way. No JVD on this side and no JVD on this side. I already assessed your pulses, and I listened to your lung sounds, and everything sounded good. And now I'm just going to feel for any swelling or anything like that, okay? All right. Okay, let me see your fingers. Check your capillary refill. Less than 2 seconds. Okay, put your feet up for me. Good pedal pulses. Any pain or swelling?
No.
No. Okay, so that looks good. Any questions for me?
No.
Okay. So your lung sound did great. Your chest rise was symmetrical. You didn't have any weird breath sounds. Your diaphragmatic expansion was good. Your tactile firmness was negative. So these are all good things. Your heart sounds, there were no murmurs or anything like that. I assessed everything. Your capillary refill's good. All you're very symmetric on your face. Your eyes looked good and healthy. Your ears looked good. You had good patency in your nose, in your mouth, and in your ears. You have great hearing, which we saw in the Ryan and Weber test. So all in all, I think this was a great exam.
Thank you.
Thanks.